I had my baby. Everyone, meet Eleanor James. She is my favorite little human. But in today's video, I'm going to share my completed or finished birth story because if you watched the last video, then you kind of saw part one of how I unexpectedly had to deliver at 36 weeks, which is why she's such a tiny little peanut. Let's see, in that last video where I ended was me making my hospital bag at like 1 o'clock in the morning because I found out I had to have a C-section because she didn't have any amniotic fluid. Well, she had very low amniotic fluid and she was growth restricted, so she was measuring a lot smaller. That contributes to her petite size as well. So I ended the video after I finished packing and how I was nervous and worried and anxious about this whole process and having to deliver early, and how as an OBGYN, I didn't expect pregnancy to be as difficult as I thought, or as an OBGYN, I didn't expect pregnancy to be like this for me. I don't know why, but I just didn't expect to have oligohydramnios, for her to be breech, to have growth restriction, all that kind of stuff. And later on, as I tell my story, you'll know that I'll also ended up developing severe preeclampsia. So let's jump into the story. I'm gonna lay her down in her little bassinet next to me and we'll jump right in. I love you so much. I'm officially 9 days postpartum. I had sweet little Nellie, we're calling her Nellie for short, from Eleanor James Maupin is her full name. But I had Nellie on 11/11 and she was born via C-section because she was breech. I want to first make this video just for me because I don't want to forget this experience, and obviously I want to document it for anyone who's going through a similar situation, an unexpected early delivery, and then my thoughts on being the patient, because typically I'm the one doing the counseling and the recommendations of when to deliver, what to expect during a C-section, all that stuff. So let's jump right in. So I was a scheduled C-section at 9 o'clock in the morning. The hospital told me to be there at 7, so 2 hours early, and I didn't sleep the night before. In the last video, I finished making my bag and I tried to lay down, but my mind just kept racing. It almost just felt like that feeling of like when you were a kid and it was like the first day of school, or when you have a big trip that you're so excited about, like that kind of feeling. And then obviously it was the last night that Corey and I were going to be a family of 2, so it was really emotional and I cried a lot. I was just anxious to meet her. I wanted her to be okay, and I'm really gonna try and make this video without crying, but we'll see. Like I said, I am 9 days postpartum, so hormones are... So anyway, we get there 2 hours early and I went with Corey and my sister, and we get through triage and registration. And as soon as I get there, like, I know I've mentioned this in my videos before, but my legs have been pretty much swollen almost the majority of my pregnancy. I do have always, outside of pregnancy, my right leg always swells a little bit, especially when I'm traveling, on my feet a lot, all that kind of stuff. But in pregnancy, it just, the swelling got so bad, which was expected. But the morning of the surgery, the swelling was unbelievable. And I was like, in my mind, I was like, this is not normal, because my baseline was at the end of the day, my legs were swollen, but then when I would wake up in the morning, they'd go kind of back down to normal. But that morning I was like, oh my God, I'm super swollen. I started feeling like my hands were really swollen and my face was really swollen. So being an OBGYN, I was like, crap, I'm pretty sure I'm developing preeclampsia, or at least high blood pressure in pregnancy. If you guys want more details on that, I have a whole video on preeclampsia I'll link below. But I also did a really good IG live or Instagram live a couple months back, so I'm gonna link that as well if you want more information on what preeclampsia is. So when I checked in at the hospital, I told the nurses, I was like, give me a minute before you check my blood pressure because I have a feeling it's gonna be high. I was already so anxious. So I was like, let's not check it right away, like laughing at me. At this point, everyone knew I was an OBGYN. But so I checked in, they gave me a gown, they gave me the surgical wipes to like, wipe down my belly and my body for surgery. And then I got in bed and everyone was so nice, the whole surgery team, the nurses taking care of me. I had an ultrasound done that morning to check her position and her fluid, which again, she was breech still and her fluid was still 4, I want to say. It was still low, so still an indication to deliver. And so then finally they checked my blood pressure and it was 164/92. And if you're at all familiar with preeclampsia, work in labor and delivery, or you work on postpartum or anything like that, you know that's technically a severe range blood pressure for a pregnant person, especially because I don't have a history of high blood pressure. My blood pressure should never be 160/90. So I saw it go off and I was like, okay, standard protocol, we'll recheck it in 15 minutes. I felt fine besides the swelling. And then the nurses drew preeclampsia labs or PIH labs just to check my liver function, my platelet, my protein in the urine, just to see if I met criteria and a diagnosis of preeclampsia. So we keep going with like the check-in process. It was really honestly fun or like relaxing. I was there with Erica, my sister, Tori, and it was an overall, like everyone was so nice. It was a good experience. And then my blood pressure went off again. And again, it was 162/97 or something. So again, 2 back-to-back severe range blood pressures, which meant that recommendation and guidelines, you should treat the blood pressure when you have 2 sustained severe range blood pressures with a blood pressure medication, like IV labetalol, or you can do nifedipine by mouth, you can do hydralazine. There's different options. So my nurse comes in and she's like, hey, that's another severe range blood pressure. And I was just like, can we just wait and check it a third time? And at this point, I think I was in deep denial that I had preeclampsia. And I was like, let's at least wait for the blood work to come back. And they called my doctor, and my doctor was like, I'd like to treat your blood pressure because it's so high. And I texted her and I was like, can we just wait and check one more? She was like, that's fine. I was the annoying patient that like was refusing treatment. And so, my poor doctor. So it went off, blood pressure went off again. It was still severe range, 3 in a row. And the lab work came back, and sure enough, I did have preeclampsia. I had high protein in my urine, and some of my liver enzymes were like trending up. They weren't super abnormal, but they should have been a little bit lower than what they were, which again is another criteria for the development of preeclampsia. And so I was like, okay, I have severe preeclampsia. I should treat my blood pressure, and then I could also start magnesium just to prevent seizures from happening, because that's what can happen in pregnancy. When your blood pressure is so high, you can actually get seizures, which obviously is dangerous for me, but also the baby. But ultimately, the treatment for severe preeclampsia, which is what I had, is delivery, which I was in the hospital to have my C-section. So the delivery was already happening. And at that point, I was about to walk back into the OR to start the surgery. So I spoke with my doctor and I was like, listen, like I'm gonna get a spinal anesthesia for my surgery. And so spinal anesthesia, or like an epidural, that usually lowers your blood pressure when you place them. So together with my doctor, we came to the decision where let's see what my blood pressure does after the spinal, and if it's still high, we'll treat the blood pressure, but if it comes back down to normal, then we won't treat it with IV medication. So I went back to the OR, and I'm going to show pictures because they let me take pictures. When I went to the OR, the anesthesiologist was so nice. He was the doctor that did my spinal. I wasn't nervous for my spinal anesthesia. I don't have a fear of needles. I've seen them done multiple times. Like I don't have a pain, or not pain. I just don't have a fear of needles, so I wasn't worried about it. Everyone made me feel super comfortable in the operating room. My doctor's first assist, Therese, like held me, because you kind of have to like sit on the edge of the OR bed and like arch your back so they find the spot. He numbed the area. I felt like a little pinch, like a flu shot to me, like it didn't hurt. And then he placed spinal, and it was like instantly my feet and my legs felt so heavy. Like it's insane how fast it was. Like this, they felt so heavy, and then I felt this like warmth from my feet climbed all the way up my body, and I was like, oh, I feel warm. And the anesthesiologist was like, that means I placed it right. So then they laid me back. My blood pressure came back down to normal. It wasn't super low, which was good. So we decided not to treat the severe preeclampsia, because again, my blood pressure came back down to normal. And during that time of like the spinal being placed and everything, it was just me in the operating room. It was just such a weird experience being a patient, because I knew everything that was happening. I knew they laid me back down and like sitting on the bed like this, and I knew the next step was to put a catheter in my bladder, to do a Foley catheter, and just to like hear them be like, okay, you're gonna feel like touch and maybe some pressure, but it shouldn't hurt, which I like tell my patients, and I hear the nurses tell the patients all the time. But to be the patient, it was wild. And I kept saying that. I was like, this is crazy. This is so weird. And so they put the catheter in. It was just like pressure, but I didn't feel pain. And I knew that's what they were doing. And then they put my legs back down. Like I could feel, I just knew the steps, so I could feel everything that was happening. And then they prepped my belly with the chlorhexidine, like the sterile solution. And I had to wait 3 minutes for that to dry before they put the blue drape on. It's just me thinking back on this. Like it feels like this happened years ago, but it was literally 9 days ago. So anyway, they do that. And while they're waiting to dry, they do the timeout, which is something that happens in every single surgery that is done or procedure that's done. The nurse makes an announcement, my name, why I'm there, and what procedure is being done. And then anesthesia confirms that they have the right patient, that they agree with everything. The scrub tech, that she agrees, and then the surgeon and everyone in the room agrees that we're all doing the same procedure and why. And so to hear the timeout where it was about me, I thought was just as funny. So everyone, goes through their little spiel, and anesthesia is like, I agree. My doctor was like, I agree. And then at the end of it, I was just like, and I agree. I was just like, it's weird not saying that I agree, because typically when I'm in an operating room, I'm the last one to agree as the surgeon. I don't know, it was fun, and we were all laughing and having a good time. And then after that, they put the drape on my belly. And the whole experience of a C-section, I'm not gonna lie, I did not enjoy it. It wasn't painful. The pressure you feel is pretty intense, which again, I'd always counseled my patients, but I'd never been through it. So it's hard. Now I can describe it because I've been through it. Now I know what my patients feel, which is really cool. I think that's going to make me a better clinician and a better doctor because I can say I experienced it. And I didn't enjoy it because I think I knew the stuff and I knew what was happening, right? Like ignorance is bliss, I guess. Like if I wouldn't have known the steps and the layers and what she was cutting through and what instruments she was using, like I could just see it all in my head. And that kind of freaked me out. And it was like, she's like incision. And so she starts and I'm like, okay, she cut my skin. Now she's using the bovie. I could hear the little noise of the bovie and I'm verbalizing all this out loud. And everyone's kind of laughing and Steve's just like, that's so funny that like you're doing this. And I was like, okay, now they're on my fascia and now they're going to stretch and now they're going to use the bladder blade and do this. And it was just really weird. And so once I get down to my uterus and she made a cut on my uterus, I heard her say uterus, and then Nellie was born like super quick. If you've ever had a C-section, oftentimes, especially if it's your first one, from the time they cut or we cut your skin to baby is like less than 5 minutes typically. Like especially if you've never had abdominal surgery before, like I'd never had abdominal surgery. So I think from like the start of the incision to birth was like maybe 2 or 3 minutes. And as soon as she cut my uterus, the pressure that was applied on my belly to help get her head out because she was breached, oh, the tugging and the pressure was just like, the whole time I kept like grimacing, I'm assuming, because anesthesia would be like, are you feeling pain? And I'm like, no, it's just pressure and it's weird. And he's like, I know. And anyway, at that point, Nellie came out and there's like a double drape. So there's a blue one and then there's like a clear one. So they dropped the blue one. And again, I'll share pictures. And I could see Nellie through the clear drape, and her little foot, because she was breech, her little foot was just like up, which is typical for breech babies. Like they tend to like the little limb that was up. And I could touch her through the drape and she was so cheesy. She had so much vernix, is like that cheese that covers them. It's almost like a skin protectant. It's actually really good and healthy for them. You just kind of rub it in. If your baby's born with vernix, we say just like treat it like lotion and kind of rub it in their skin. But she was so cheesy and she had hair and she cried immediately and cried and cried. And that made me feel so much peace. Like, listen, I did not enjoy being pregnant. And it wasn't until she was delivered that I could verbalize why I didn't like being pregnant. And I think I just didn't realize that my anxiety was so much worse because I was so worried. Because I like knew too much. And I realized that now that she was born, because when I saw her through the drape and I saw that she was crying, it was like an immediate lift off my shoulders and a weight off my shoulders because she was fine. Because I could see her and touch her. I knew that she was going to be healthy. And I've never felt better in that moment. Like that was just it for me. Like as soon as she came out and I saw her, it's like I could breathe. It's like I could take a breath again. I was like, we're going to be fine. It's crazy. It's crazy how immediate that like relief of pressure and worry and guilt and doubt and everything just left my body in that moment because I could hear her crying. I could see her and I could touch her little foot through the drape. After that, they cut the clamp. They did delayed cord clamping, which I wanted. They cut the cord and took her to the warmer. Corey was with me the whole time. I was like, Corey, go be with her. Go be with Nellie. And so he went over to the little area where they were doing her measurements and her weight and her vitals. And one of my biggest things going into the surgery is that I really wanted to do skin to skin. That was one of my biggest things. Like as soon as when I got pregnant, I thought I would have a vaginal delivery. That was the plan. I always wanted to do golden hour and skin to skin because the benefits of holding your baby right up to your skin and your chest right after delivery is so beneficial for bonding, for breastfeeding, for sugars on her, for temperature on her, for just, and it's amazing. And so that was my biggest thing, that sometimes C-section babies don't always get to do skin to skin, especially her being premature, her being so small. But she's so strong and she's amazing. And after about 5 minutes, they were like, hey, do you want to do skin to skin? And I was like, yeah. And I have pictures of that. So they put her right on my chest and I got to hold her until the end of the surgery, which was incredible. And again, it was just such a peace and such a happy moment. And I'm so glad I have pictures of the moment and that everything was documented. Like it's just so special and I'm so proud of little Nellie. Like she's already so strong for being so tiny. She weighed exactly 5 pounds even, 17 inches long, and just absolutely perfect. She's perfect. She's beautiful. I know I'm biased, but she's a dream baby. I'm just staring at her over there. She does so well in her little bassinet too. So after that, after they were done with the surgery, they wrapped Nellie up and they gave her to Corey and they waited for me in the PACU and everything went great. In the PACU, that moment of being in the PACU, to be completely honest, I feel like is a blur. My parents came, they met Nellie, they got to hold her. I took a bunch of pictures and at that point I was so tired. I don't know if anyone actually took pictures of me or not very many pictures of me during that time. I don't know. But my parents were there, Erica was there, and I remember fighting sleep. I was like, I just want to close my eyes. Like, I am so tired. It was a mixture of like, I didn't sleep the night before because of everything going on. And obviously the stress of surgery, everything that was going on. I felt really swollen. Thankfully, I didn't have any more severe range blood pressures after that. But the edema and the swelling was just so bad. And I remember the nurse at some point was like, hey, do you want to see lactation for breastfeeding? And I was like, yes, because my plan is to exclusively breastfeed for 6 months if it works out. I'm trying not to put too much pressure on myself with breastfeeding, but so far so good. So I asked them to bring lactation over to the PACU. And again, I like vaguely remember it, like teaching me how to latch and how to hold, but I was so tired that at one point I think I was just like, can we do this tomorrow or like later today? Like I'm exhausted. And I think everyone could see that I was like super drowsy, super out of it, and I just needed to sleep. But to be completely honest, the whole experience, start to finish, from the C-section to the PACU to then going up to postpartum, was really smooth. My least favorite part was the C-section part. Again, I think I know too much. I think I knew too much going into it and it made it really weird. But again, it wasn't painful. It was just weird. It was just weird. I can't describe it any other way. Oh, one more thing also before I forget. After my C-section, the anesthesiologist did what's called a tap block, and that's where they inject local anesthesia around your abdominal muscles to help with pain, to limit the use of narcotics in the postpartum period. They also do tap blocks for like other abdominal surgeries, and like colorectal surgeons also do it as well. I really think it should be the standard of care. I loved my tap block. It helped with the pain and the healing so much. I did not feel pain from my surgery until probably like over 24 hours from the surgery, where that's when I then decided to take Tylenol and ibuprofen. But I didn't take a single narcotic. I didn't pick up my Percocet prescription. I didn't take any narcotics at the hospital. I did have Toradol, which is like a strong NSAID, but I did not have narcotics, which is really cool. And I honestly attribute that to the use of the tap block. I was able to get up and walk around after my surgery. I did get nauseous and I threw up, but that was more so like the side effect of the anesthesia and the stress of the surgery more than like I wasn't in pain. I just am sensitive when it comes to nausea and vomiting. And so that was like the biggest hiccup. But again, I didn't feel pain. So if you have the option to get a tap block from your anesthesiologist, if you're having a C-section, ask for one. I don't know that it's a standard of care everywhere, but I think it's worth it to ask because I loved it. I think it just really helped with healing. So if you have it offered to you, I would take it. And yeah, the whole experience from like start to finish was really smooth. It was just the C-section's the only thing where I was like, I did not love that. Maybe I wouldn't have loved a vaginal delivery. I don't know. I haven't done it. I'm gonna stop this video here, but that's it. I just wanted to share my experience with the delivery, and I wanted you all to meet Eleanor, and I wanted to let you all know that I am doing 1,000 times better. Postpartum is hard. These 9 days have been hard, but these 9 days have also been the best ever. I'm hormonal. My emotions are up and down. Cried every single day, but in a good way, because I just look at this little Eleanor and I can't believe she's real. I can't believe how cute she is and how big, bug-eyed she is. Like, I just think she's so beautiful. And yet I'm tired. There's lack of sleep. Pumping and breastfeeding is hard. She's on a hard feeding schedule because she's so small. She lost a little bit of weight, which all newborns do, but now she's 4 pounds 14 ounces. So she didn't lose that much, but still, the pediatrician wants her on a tighter eating schedule with more caloric intake. So we are supplementing with formula until my breast milk fully comes in, which I think now I'm starting to see a difference when I pump, and she's getting more full when I breastfeed. So I think my real like good rich milk is coming in, which I'm so excited about. I've relied so much on friends and family who have been incredible throughout this whole process. It's hard, but it's the best. And I'm so happy. I feel so much better mentally. Like I mentioned earlier, since she's been out, it's like I feel like I can breathe again. I feel like myself again. So yeah, pregnancy wasn't for me, but that little cutie pie is worth every single bit. So yeah, that is the end of my story. Don't worry, I will make more videos on this postpartum journey. I also want to make a video on breast pumping and feeding because I have learned so much about breastfeeding and pump parts and timing of feeding since I had her. And I wish I had a video. Well, I did find some YouTube videos, but I want to make one for you all so that you might benefit. And if you're breastfeeding or you're about to deliver and you want to know how to use your breast pump or whatever it may be in the future, I'm gonna plan to film that video. Anyway, I'm gonna end it here. I love you guys. Thank you so much for all the love on my last video, for all the love on my Instagram post, all the love for me, Ori, and little Eleanor. I'm so happy. I'm just trying to soak in every single moment, and I'm taking 1,000 pictures of her because she is perfect. I love you guys. I hope you have a good week, and I will see you in my next video. Bye.